My name is Amanda, and I'm with Tampa Hillsborough County Public Library, and I'm very happy to welcome back Rebecca McDonald, who is with the SHINE program. And if you don't know what that stands for, SHINE is Serving Health Insurance Needs of Elders. We
Good.
are in the middle of the Medicare open enrollment period, so Rebecca is going to go ahead and share some information with us about that. We will be back we're going to go ahead and turn our cameras off right now, but we will be back at the end to go ahead and answer some of your questions.
Okay, let's see if I can do this.
Oh,
Eh,
perfect.
Good. Well, hello everyone. Thank you for joining us. As she said, I am a volunteer. Because I don't know if the screen is showing. There's a little thing in the middle, but and I hope you're seeing a full clear screen. Um,
I do want
I
to say it looks good to us, Rebecca. We're seeing the
okay,
full
okay,
screen.
good. Then I won't worry about it then. So I am a volunteer with the SHINE program, and SHINE is one of the many programs that the Department of Elder Affairs has for um, Florida seniors. Well, now my thing's not working. Oh, we checked everything, but moving ahead here. The SHINE is program is one of the many programs that the Department of Elder Affairs has for Florida citizens. So to give them resources to age with dignity and purpose and independence so that they can stay home as long as they can. Our particular mission is to provide free and unbiased health insurance counseling so that Floridians and the disabled can make informed choices about their health care. As I said, it is a free and unbiased program. We don't recommend one health plan over another. We're not an insurance company and we don't sell insurance. All we offer you is information, and hopefully I had one lady today said, oh, now I know where to start. It was so complicated. So basically we kind of give you a way to get started and how to figure out what health plan is best for you. So all of these programs and resources out throughout the state of Florida go through various resource centers, and ours is called Senior Connection Center. We serve 5 counties: Hillsborough, Hardy, Highlands, Polk, and Manatee. So when you call, you will be talking to a counselor from that particular county, so they'll be familiar with what health plans are available in that county. So if you don't leave with anything else tonight, write this number down. It's 1-800-963-5337, 1-800-96-ELDER. If you listen to this and then all of a sudden you can't remember a word I said, you're just going to call that helpline and say, I listened to this lady last night. I don't know what she said, but I need more information. They're going to get your information, and a counselor will call you back and clarify things that you didn't understand. So that's where you're going to start. People say, I don't know where to start. That's where you're going to start. Um, what does SHINE do? We do anything that has to do with Medicare. We counsel and help people with original Medicare, which used to be all there was, Medicare Advantage plans, which is now called Part C. These are your HMOs and your PPOs. Prescription drug coverage, which is called Part D. Medicare supplement insurance, Medigap. We show you how to go about trying to find a Medigap policy that's good for you. Extra Help for Prescription Drugs is a financial assistance program, one of 2 that we do help people with. And this is a program through Social Security that helps people with prescription drug costs. Medicare fraud and abuse. This has really been in the news a lot lately. I guess there's a lot of people figured out how to make money off of senior citizens with COVID testing or something, but we actually have volunteers within our program called Senior Medicare Patrol who dedicate themselves strictly to anything that has to do with Medicare fraud and abuse, and if necessary, they will actually bring them to court and take care of it. They're very good. So the other financial assistance program that we have is the Medicare Savings Programs for low-income people. This helps people with Part B and Part A premiums. So again, later on in the program, there's a handout with those financial limits on it. So that may be helpful for you to download and print out. Long-term care planning, we have counselors at Senior Connection Center that will talk to you and help you get started with long-term care planning. It's a lengthy process. There's usually a waiting list. So if you see this on the horizon with you or a loved one, now would be the time to get started. You call that 1-800-96-ELDER number and say, I'd like to talk to someone about long-term care planning, and when someone will get back to you and get you started on that road. So when the time comes, you'll be more than prepared. And of course, Medicare complaints and appeals. we all have complaints about Medicare, but this is when they turn down a charge for whatever reason, and so we can help you fill out. There's an appeal process that you can go through, and they do change their mind when presented with the proper documentation. So that's what we can help you with and give you information about. And of course, outreach, which is what I'm doing now. So today I'm talking about Medicare open enrollment period, which is kind of lost a little bit with all the election stuff. But I can guarantee you that tomorrow night, when there's no political advertisements on TV, you're going to see a lot of advertising for Medicare open enrollment. So just kind of got lost in the shuffle with all the political stuff. But it started on October 15th and it goes until December 7th. It's the opportunity to add or change coverage. So for people that already have Medicare, it doesn't have anything to do with people new to Medicare because they have their own special enrollment period. Say you picked a drug plan last year and now you're taking a couple drugs that aren't covered by that drug plan. So now you want to find another drug plan that covers those drugs. Now is when you're going to do it. You would go through and look at the drug plans and find one that covers your new drugs, and you change, and then effective January 1st, you have your new drug plan. So that's what we're here for. That's what we help people do, compare plans, and sort of like checking your car insurance. It's good to do that every once in a while and see, can I save money on copays, or can I pay a lower premium and get the same copay for my drugs, or stuff like that. So I'll say right now that if you're happy with what you've got and they haven't raised your premiums and they haven't raised your copays, or at least only raised them enough to where you're still happy with them, you don't have to change. You don't have to change. If you're happy with everything in your health care, um, you don't have to. A lot of people, with all the advertisements and the talk and the mail we get and stuff, feel like I have to change, I have to change. But no, you don't have to change. If you're happy, and just ignore everything we're saying. So you don't have to feel pressured. That's the main thing, is that you should not feel pressured to change. Because you're going to get, so the where you start out with is the annual notice of change. By the end of September, we should have all gotten this notice of change. This year, instead of getting it in the mail, I got mine in an email, which is a little bit different. So you want to pay attention to that, because that's what tells you whether your monthly premium is going to change, if your deductible's changing, if your copay is changing. So I think on a couple of my medications, my copay went up by like $5, which wasn't enough to make me want to change. So I put that, saved that email so I could go back to it for a reference. But so they're doing it in different ways now. And you look at that, and if they haven't made any changes, then you're happy with what you've got, then you can just, go read the newspaper or something. But if you do want to change, then now is the time to do it. Marketing is supposed to wait until October 1st, but I think a lot of them started early. So that's just marketing. You're going to start seeing a lot of that on TV after all the political stuff has kind of got lost and all that. But just don't have to be pressured. You maybe go to a health fair, or you may go to something where there's different vendors, and they're going to, say, oh, this is the best plan, you should go with us. But just take your time, because again, you don't have to make a decision until December 7th. So you have a lot of time to explore your options. So one good thing is to kind of review what the Medicare paths are, the different ways to get your Medicare coverage. So you either have original Medicare, which is Part A, hospital coverage that has a deductible, and Part B then, which is your medical, which is everything else that has a deductible, and you pay some copays or premiums, because Part B only covers 80% of the charges allowed. Under that, you have optional coverage, which includes Medigap, which is just what it says. It bridges the gap. It pays the portion that's not covered by Part B. Some of the plans will pay deductibles and whatnot. This is not through Social Security or anything. This is through private insurance companies. So you'd have to do a little bit of homework on Medigap policies and do a little phone calls and stuff to kind of compare prices. But the main thing is to figure out what plan you want, which some will just take care of your copay, and some will do your copay and your deductible. So you figure out what plan, and then you try to find the lowest price for it. So that is pretty competitive. And Part D prescription is under optional, but it's only optional if you have drug coverage. Medicare really wants everybody to have health coverage, Part B, and drug coverage. So if you figure you're really healthy and you don't take any medicines and you just, "Oh, I'm going to save my money, I'm not going to pay those monthly premiums," there are penalties that are assessed. There's a penalty for Part B and one for Part D. They're a little bit different. It's not thousands of dollars, but it is on a monthly basis. So for every 12 months that you go without Part B or Part D, when you finally do get that plan, there's going to be a penalty added on to the premium that you're paying. So it's, they're not that expensive. And like for prescription drugs, a lot of people just get the least expensive one and they're happy and Medicare's happy, and then you don't have to worry about any penalties. So that's one way to get your health coverage. Or you can go to the other side of the page and get what they call Part C, or a Medicare Advantage plan, which includes hospitalization, medical care, and Part D. So it's kind of like a one-stop shop. On the left side of the page, you're paying your Part B premium, possibly paying a monthly premium to your Medigap company, and you're also paying a monthly premium to Part D prescription drug plan. With Medicare Advantage, you're paying one premium a month, which is your Part B, $144.60. We haven't gotten any notice about whether that's going to go up yet or not. So you're just paying one premium and you still have the same coverage. And you have co-pays instead of, so like your Part B, you have the 20% that's not covered. With the Medicare Advantage, you have a co-pay. Everybody has a co-pay. So it includes all your prescription drugs and you have co-pays for those. So we're all getting our Medicare, unless you have railroad Medicare, but we're all getting our Medicare one way or the other like that. So what you can do during open enrollment is to look at your well, this slide is sort of out of place. It kind of ruins the flow, but credible coverage. When I said you did not have to get a drug plan if you had another drug plan, maybe from a spouse or from a retirement thing, as long as that plan is credible coverage. It has to be credible coverage considered, so that otherwise you will have a penalty if you don't get Medicare. So you can, if you have another drug plan, just call them up and say, is this credible coverage? Or if you're covered under your spouse's health care plan, check with HR and say, is this considered credible coverage? And if they say yes, then you don't have to worry about signing up for Part B when you turn 65. You're not going to have a penalty because what you've got is considered credible. So that's the main question. Of course, if you buy a drug plan off of somebody on the street, I don't think that would be creditable, and you probably would end up paying a penalty when you get a Part D drug plan. So that's just something to remember about. If you have that, you don't have to get a Part B and you don't have to get Part D, and you're not going to have any penalties. So during open enrollment, you can change prescription drug plans. Like I said at the beginning, if were really happy with your drug plan last year and then your doctor added a couple new diabetes medications, or one, I was talking to a lady one today about one that's really expensive, and all of a sudden the plan that you have doesn't cover it, or covers it like with a really high copay. Now would be the time to go look at all the drug plans and see if you can find another company that has a lower copay for that particular medicine. So that's a lot of times we can save people quite a bit of money. I had a lady that signed up for a drug plan and she was paying a lot for her medications, and she came in and we found her one about $70 cheaper. And I said, well, what made you pick that drug plan when she said, well, I just recognized the name. It was a name, and she just, when the time came to do Part B in a drug plan, she just picked one that she recognized. Well, it ultimately cost her quite a bit more money until we sat down and went through it. So she was pretty happy. So you do have to do a little bit of homework, and that's what we're here for. We're always happy to help people, show you how to go through the process. So if you're not happy with your drug plan for any reason, go in, find one that maybe's got lower copays, or maybe does mail order, or for whatever reason, you can change your drug plans. You can add or drop a prescription drug plan, like if, again, just sort of repeating what I just said, the drug plans, but make sure that you have credible coverage. So maybe your spouse has a job and they say, okay, we're going to give you prescription drug coverage. And so you say, oh, good, I don't have to have a Part D plan anymore, and you just drop it. but you have to ask if that is creditable coverage. So if it's not, then you would want to go ahead and keep your Part D plan. Or if your spouse, you're covered with prescriptions by your spouse and he doesn't have that anymore, and you say, oh, now I need a prescription drug plan, open enrollment's the time to get the prescription drug plan. So um, and just make sure all your drugs are covered, so that whatever you do when you do the plan finder, make sure you have a list of your medications, because there's nothing worse than signing up for a Part D plan because it saved you a lot of money just to find out that it doesn't, you picked one that didn't cover 2 or 3 of your medications. So prescription drug plans usually is where most people will change during open enrollment, just because they've added drugs that aren't covered, or they've dropped some drugs that were expensive or whatever. So this is where it's like kind of car insurance. It's good to check it. Um, and down there, that red arrow, adding a penalty may apply, but again, that goes back to creditable coverage. So you can switch from original to a Medicare Advantage plan. So like I say, this is a time when you could just about do anything that you want to do, change anything around. Um, Check your out-of-pocket expenses for whatever. If you're going from with original, you don't really have a good idea of what out-of-pocket is, because you don't know what the 20% is going to be. With Medicare Advantage, it's pretty well spelled out. You're going to pay $225 for outpatient surgery, or $50 for a copay for a specialist or something. So when you go look at Medicare Advantage plans, they're going to be able to tell you how much you're going to spend, not counting what you spend on your drugs, of course. So you can switch, though. A lot of people, when they first retire, they like to travel, and Medicare Advantage plans don't really travel that well because they're really local. So they'll take original Medicare and a Medigap policy and a Part D, and off they go. And then 5 years later, they've decided they're done with traveling, and so just to save a little money, they can switch to a Medicare Advantage plan and save a little money and have a primary care doctor. Keeping in mind that the best time to get the best price for a Medigap policy is the first 6 months of when you start Part B. So you can go back anytime and get a Medigap policy. So these people have traveled 5 years, and now they decided they're going to stay home, and then they didn't like staying home for that year, so they decided to travel again and go back and switch it, but they're not going to get their Medigap policy for the price that they had. It's going to be more expensive. So these are all things to consider. You're covered for vacation. If you go on a 2-week, 3-week vacation, your Medicare Advantage plan, you have coverage. But if you're going to be spending half a year here and half a year there, you're probably better served with original Medicare. Is my doctor in the network? So when you're looking for Medicare Advantage plans, make a list of your doctors, call the doctors and say, what Medicare Advantage plans do you take? Because they have the list of doctors that each plan, they're useless. You could lose a week of your life trying to figure out what doctors are on their list of doctors they take in their network. So the best thing to do is just call the doctor's office, ask to speak to the insurance person, and have her give you, in some cases, it's easier for them to tell you what they don't take, because most primary care offices take most all of them. So the list may be shorter for what they don't take, but just make sure that your doctors are in the network, even the doctor you only see once a year, because why would you go pay full price, when you could get a Medicare Advantage plan that he's in the network. So that's just something to pay attention to. And of course, the drugs, I think we've probably emphasized that quite well by now. So you want to make sure that all your drugs are covered. You can switch from an Advantage. Of course, you can go the other way and go back to original Medicare. Like we said, if those people have been traveled and they stayed home and decided they didn't like to stay home, and now they want to go back to a Medicare Advantage plan, they can do that. But just they'll have to get a Part D, and they may or may not choose to get a Medigap policy. But just make sure that whatever drug plan you get, that your drugs are covered. So that's the important thing. And of course, you can switch from one Advantage plan to another. Most companies have HMOs and PPOs. An HMO, you need authorization to go see from your primary care to go see someone. PPO, you just have to stay in the network. So each company usually provides both, or you could change from company X where you're not happy with them, just for some reason you're just not happy with them anymore, you can switch to a different company and get an HMO. So you can just do pretty much whatever you want to do as long as you have a health coverage by January 1st. So again, this is what Shine Counselors can help you with. So you could go from a plan with prescription drug coverage or without. Again, that just would depend on what your status is with drug coverage. Just make sure that if you have drug coverage, not Part D, you have credible coverage, creditable. So how do you do all of this? Well, you could call us, 1-800-963-5337, and say, I need help with open enrollment, and they'll get a little bit of information, and then you'll be assigned a counselor, and the counselor will get back to you in a couple days, and we'll go over everything with you. Medicare.gov, this is the website, and those little green squares there, you'll see the one that says Find Health and Drug Plans. It's pretty easy to use. Takes a little getting used to. I helped a lady just figure the website out today, so now she can, just at her leisure, go through and compare the plans, and so that just was a big help to her. You can call Medicare. Sometimes they'll help you with plans, but mostly they'll just give you our number. So I do like to keep Medicare in the loop. If you're changing plans, I'm kind of old school. So if you're changing plans, just call Medicare and say, I'm going from this plan to that plan. I just, it's kind of, there's a lot of changes on January 1st. So the more people you let know there's a change, the better. Less confusion. And of course, the plan, call the plan. You can call them. They may talk to you over the phone. They may want to send someone out. That's up to you, whatever you're comfortable with, but doesn't matter. Even if they send someone to the house and you have that presentation, you're not obligated to buy it. I know we all feel like we should sign since that nice person went to so much trouble, but you don't have to sign. You have until December 5th. So don't feel pressured into buying something that you're not 100% comfortable with. I want to talk briefly about the financial assistance program. So if you want to print this out, there's the Medicare Savings Program that goes through Medicaid, which helps people with Part A and Part B premiums. So that could be a big benefit to some people in the lower income that are having trouble, making ends meet if they didn't have to pay their Part B premium. So it gives the income limits. And then the other program is the Extra Help or Low Income Subsidy, which goes through Social Security and has to do with prescription drugs. So again, if you print that out and see if you have a friend, neighbor, relative, whatever, that's kind of struggling, say, well, look, do you think you qualify for, are you in these income limits? And then just give us a call and we have counselors that'll help you with the application or answer your questions. So that could be really a lot for some people. And of course, we did discuss Medicare fraud and abuse a little bit. If you find a mistake by your provider, give them a chance to rectify it. Don't assume that they're doing Medicare abuse. Mistakes get made. So as long as the provider pays back the money to Medicare or corrects the mistake, then you're okay. So give them a little bit of time. And of course, there's always people out there trying to get our money. So they're just, for every new thing that Medicare comes out with, there's always people trying to figure out how to scam us about it. The best thing to do is to guard your Medicare number, your Medicare card, just like your Social Security. Check your Medicare summary notices or your explanation of benefits, and make sure that they're not paying someone that you don't recognize. If you see they have, call us. I called and checked for a man, and it was the billing company for his physical therapy. So he felt quite relieved that Medicare hadn't paid all that money to some company he didn't even know about. So it's just like any place else. If you see something, say something. So, okay, so I think we have a little bit of time here for questions. I can go ahead and put that
Okay,
back
so we'll
on.
go ahead. I do want to remind anybody at home, there is the question section there in the control panel. We do have a few that have come in, so I am going to read those. But before I do, Rebecca had mentioned some handouts. Those are in your control panel. You can download those in the handout section. It is one of the drop-down sections there. There is PDF. You can download them. They will be downloaded as a PDF to your computer. So even if you can't print them, you can save them,
Oh,
or you can
okay.
print them off at home. Yep. So you have access to them. But you do want to get this. This is only for the live broadcast. You want to go ahead and take advantage of those while we can.
If
Okay,
not, you could always call that number and just say, I need the information. So
very
yeah,
good point. Very good point. And we did also put, I know that was in the slides, we put the 1-800 number. We also put that in the link. If you want to copy and paste it somewhere, uh, we have that there for you. So let me get into the first question, which is, what if I don't want to make any changes? If somebody who's already has their plan, if they don't want to make any changes, do they have to go into the open enrollment session or can they just leave it?
they can just sit back and read their newspaper. They don't have to do anything. Don't even have to listen to the commercials. So you're good. Yeah.
Well, that's good. And I think especially the newcomers get a little confused because in the private sector, a lot of times, or with your company health insurance, you do have to
Oh
go in
yeah,
every
that's right. Yeah. No,
last.
if you're happy with what you've got, just as long as you pay them every month, like your Medigap policy, and they keep Social Security takes your money, you're fine. You don't have to do anything. So it's just for
And then
people that want to change.
can you repeat to us the end date of the open enrollment period?
It's December 7th.
December
So it's
7th.
October 15th to December 7th, which I believe is Pearl Harbor Day for those of us that are of a
It is, yes, I
generation.
think that is the for a little historical note. Very
Yeah.
nice. So there is still time, and there is still time to do
Oh
your
yeah.
research. I like that you gave a lot of, speak to your primary care physician. Another question we have, and this sounds like somebody who's not quite at Medicare yet, but is going to be getting there soon. The open enrollment period is only for people who are already enrolled, but it sounds like your Medicare, your first enrollment would be when you would be birthday related or
Right.
okay, so you would already be enrolled for Medicare. This would not be
It
when you
may
would
co it may coincide. Like if you turn
okay.
65 on October 1st, then you're going to
Oh,
enroll in Medicare as it happens like during open enrollment. But it's not, you don't want to wait until open enrollment to enroll in Medicare. Enrolling initially, it has to do with your 65th birthday, whenever that is.
so it could coincide, but the open enrollment period is not going to be probably for the birthdays that fall outside of that. You're going to be enrolling the first time based on
Right.
your and
On
maybe not in this window. But
mhm.
once you're already enrolled the next year, that's when you can change your plan.
Right. Yeah.
And
So whatever choices you make this year on October 1st when you turn 65 comes open enrollment next year, then if you don't like your choices, you can change. Yeah.
and then what in terms of if you change your primary care physician, would you need to do any change if you change your primary care physician, would you need to do any change during the open enrollment period if you want to stay on the same plan, or
Your
can you
physicians really don't have that much to do with it. I mean, if say you're in, you're in an HMO or a PPO or a Medicare Advantage plan, and you change physicians, you just want to make sure that you get a physician that is in that plan. But if you change physicians, that's just like I say, if you're the doctors that you want to go to, if they all take the plan that you're kind of liking, that's good for you. But out of 5 physicians, if they don't even have one in common, then that makes it a little bit more difficult. But you just have to make sure that if you change physicians, that physician is in that plan. Otherwise, you would be charged out of network fees.
And then this is actually something we were talking about earlier, and you said one of the plans does not travel well. So this might be something if somebody is maybe what we consider a snowbird who's going to be living in two locations, would that have a bearing on maybe the selection you make for your Medicare plan during
It
open enrollment?
it I usually will tell people yes, because your Medicare Advantage plans are usually local. It uses local doctors, local networks, local hospitals, local drugstores and everything. So if you're going to be out in Arizona, you kind of have to get special dispensation, so to speak. So if you know that you're going to be somewhere else for 3 to 6 months, you're much better served by having original Medicare and a drug plan that travels anywhere.
Okay, so just yeah, it is very a forward thinking plan, thinking of, what the
Yeah,
year or the upcoming years are going to be like. Well, it looks like we are running out of time. I do want to let everyone know if you go to the chat section, Rebecca will be back with us doing a little bit the next program I believe will be about financial assistance for
I think it
Medicare.
is. Yeah, but
That is going to be next Tuesday, so not tomorrow, a week from tomorrow on November 10th, also at 6:30 p.m. She will graciously, we are so happy she'll be back with us to go over a little bit more for another Medicare program. So thank you so much, Rebecca.
Thanks everyone for listening.
Yes, we will look forward to seeing you on next Tuesday.
All right. Good night, everyone.
Thanks. Have a good night.
You too. Good night.
Goodbye.